Tooth decay or dental caries is one of the most prevalent chronic diseases in both adults and children around the world, but it's completely preventable. So what can we do at home and at the dentist to help reduce the amount of tooth decay that we have and possibly even reverse any cavities that we might have? The first thing that we want to look at to really understand what we can do is what actually happens whenever we're getting tooth decay. So if we have a tooth like this and there's bacteria in our mouth, if we imagine that the bacteria look something like this, and these bacteria are called strep mutans, and they are the main bacteria that's responsible for causing tooth decay. Now, as they're not able to stick to our tooth, but they make a biofilm called plaque, and that plaque then allows them to stick to our tooth, and that's when the decay process will start. So these guys work by taking the food that we eat, whether that be sugar or bread or kind of really any carbohydrate. They take that and they use that to make their own energy, but also a byproduct of their metabolism is acid, and it's that acid that's going to start to cause the problem for us. So here, that acid is going to start to dissolve into our tooth, and that's going to start to cause calcium and other phosphates to come out of the tooth, and that'll start a process then called demineralization. And if demineralization happens for long enough, that will start to cause dental caries or a cavity. And that's when we're going to start to get tooth decay. It is important to know that this demineralization process is not just one way. It goes back and forth all the time between demineralization and remineralization. And there are lots of things that we can do to help promote remineralization and bring down demineralization. And it's a very fine balance. And if we think of it kind of like as a seesaw, where over on this side we're going to have caries, and over here we're going to have no caries. The bad things are over here and the more protective things are over here. And so over on the bad side we'll have things like if we're eating a lot of snacks or we're snacking a lot, if we have poor oral hygiene, will be one of the main things, so we're not brushing our teeth. And the other thing then is to do with our saliva. If we have a low amount of saliva, or the quality of our saliva is poor, and you might have low saliva, it could be something, just genetically people don't produce as much saliva as other people, or the quality of your saliva might not be good. It could be also to do with certain medications that you're taking, or it could be if you've had to have a salivary gland removed in the past for whatever reason, you might not be able to produce as much saliva then as well. But there are other things on the other side as well that we can do. So we can reduce the amount of snacking that we do. We can improve our oral hygiene, and that's just better brushing, flossing, using a fluoride toothpaste. Really trying to improve our saliva and doing things that are going to help our saliva as well. And the last one is antibacterials. Things that will actually help remove the bacteria that are causing the decay in the first place. So as you can see, if we want to try and improve our protective things, we have to reduce our snacking, improve our oral hygiene, and try and improve our saliva in certain ways, and antibacterials, and those will help tip this seesaw in this direction, where we're going to prevent having any tooth decay. So if we take a closer look at those protective factors and what we can actually do with those. So one of the ones there that we mentioned was our diet, and that's, as you would imagine, trying to reduce the amount of sugar or snacking, and it's more to do with the frequency of what we eat, and that can be a whole other video as well. That's a whole other topic to talk about as well. But reducing the frequency of how many snacks that you're eating, We all eat snacks, we all eat chocolate, and as a dentist, I'm not telling you don't eat chocolate, but it's to do with the frequency. If you're having chocolate every 20 minutes, that's going to increase your risk of getting a cavity or needing a filling then. Whereas if you're having that all around meal times, it's just happening once in the day and it's less likely to have more of an effect as well. So that's what happens with diet. The other thing is our oral hygiene. And that means brushing our teeth at least twice a day, using a fluoride toothpaste, flossing, and using mouth rinses as well. Those are kind of all the things that you would think of immediately. But there are a few other things that we can do as well. If we think about our saliva is so important with our teeth. It's our body's natural way of wanting to remineralize the teeth. And if we can promote our saliva or have more calcium, more phosphate in our saliva, then that's going to help promote the remineralization of our teeth as well. One thing that we can use with our saliva is xylitol. Xylitol is like a sugar, it's a sweetener, but if we think back to the bacteria up here, if we have xylitol, then they're going to try and eat the xylitol the same way that they would the sugar, but they're not able to metabolize that xylitol, so they don't produce any energy from it, and they don't produce any acid then as a result of that, so they end up dying off, and so there's just less of those bacteria that are causing tooth decay then. So xylitol does two things. It's going to help promote the amount of saliva that we have, and it's also going to kill off the bacteria that are causing tooth decay. So that's a really, really powerful combination. So we should have xylitol if we're eating a meal, we've just had our dinner, and for then maybe 5 to 15 minutes after our dinner, chew on some chewing gum that would contain xylitol, sugar-free gum that contains xylitol, and that will help it promote the saliva. That's going to do lots of things. It's going to help move food that might be stuck in between your teeth. The actual act of chewing on things is also going to help remove things from in between your teeth. It's going to produce more saliva, which is going to help remineralize our teeth as well. So that's going to do a lot of things for us. The other thing and the last thing that we'll talk about with our protective factors is antibacterials. And I think this is probably one that people miss a lot. And the conventional way of treating a cavity is to go to the dentist and get a filling. It's a surgical approach to something. But this antibacterials gives it a more medical model as a way to treat dental caries. And the way this works is we can use chlorhexidine mouth rinses, which is shown to be quite effective at killing off strep mutans, particularly at an 0.12% concentration, which is what you would get in any of those Corsadil daily mouthwashes, but just check on the bottle that it's 0.12%, because that's what you want. And the trick with this, I call it the rule of ones. It's for 1 week and 1 month for 1 minute every night, and at night time, that's the other thing, at night time, you rinse chlorhexidine around your mouth for 1 minute, and that will help over time reduce the amount of bacteria in your mouth in general, but it will also target the bacteria that cause tooth decay. And why do we do it at night time? Well, overnight when we're asleep, the saliva in our mouth, it's not flowing, it's close to zero, the amount of saliva that you're going to have in your mouth. And that does two things. If we do it at night time and then we fall asleep, saliva isn't going to wash away the chlorhexidine that we've just used to rinse our mouth, and that's going to allow it to stick to the teeth better. And if it's there for longer overnight, it's got a more effective time that it's going to be working on the bacteria that's in your mouth. So that's why we do it at night time. This is all well and good, and these are preventative things, and that's the best thing that we can do. If we do end up getting a cavity, can we reverse it? To a degree. And if we go back to our tooth here again, and we've got our enamel, and let's look. So we're starting to get a cavity, and it's coming through the enamel, enamel. Once it gets through to this next layer of the tooth, this is the enamel and this is the dentine inside. Inside that again is the pulp, which is in there. That's where the nerve of the tooth is. So once it starts to get through the enamel and it reaches this part here where the dentine meets the enamel, it's going to start to spread outwards along this meeting point. And this is where it becomes much more difficult now to stop a cavity, because not only as this spreads, but it's also going to start to get deeper. So you're going to end up with something that's looking more like this, and it's getting closer and closer to where this nerve is in the tooth as well. If this gets too deep, it's going to require a surgical approach, and this at this stage is irreparable with these factors that we have, and we're going to have to go on and do a surgical approach. But if we just have a cavity that's on this outermost part of the tooth, if it's just in the enamel, that can be stopped, that can be reversed, and that can be reversed with these protective factors if we really go on and we're using our xylitol, and we're doing the xylitol, we're doing the chlorhexidine rinses, we're brushing our teeth, we're looking after our diet. You know, in 3 to 6 months time, that lesion could be arrested or stopped, possibly even reversed a little bit. So it depends on how far the decay is into the tooth. If you were someone who was really good at looking after your teeth and you were in this first situation, sometimes what we could do is basically just open up the enamel and expose the full extent of that decay, and now we have it open. Because if we just have a tiny little hole going through the enamel and then we've got this big cavity underneath, you know, you might be able to clean this part, but you're not going to be able to clean these parts underneath that, and they're just going to keep to decay. So I suppose in theory, if you were to open up the full extent of the lesion and have someone that was really good at cleaning and following all these protective factors, yeah, in theory you could stop that cavity from progressing any further. It would be unlikely, and there's a high chance that tooth would need a root canal, but if you have someone who's cooperative, then that might be of benefit to them. If you find this video useful or very interesting, you might like to look at this video, and please consider subscribing to the channel.